Open gloving.
Open gloving is different from the closed gloving technique that will be used to apply gloves when wearing the sterile gown.
Open gloving is used in preparation for completion of brief sterile procedures. Examples of sterile procedures of short duration include insertion of a Foley catheter and performance of skin prep. Before donning gloves using the open gloving technique, a basic hand wash may be performed. Supplies needed to don gloves using the open gloving technique include sterile gloves of the appropriate size on a flat, clean surface. Separate the edges of the peel pack and remove the inner glove package from the outer wrapper. You may touch the inner glove wrapper with your bare hands and place it on a clean surface. Partially unfold the glove wrapper. Orient the package so that the right glove is on your right side. Plan carefully, because once opened, the glove wrapper may not be relocated. Use caution not to reach over the exposed inner portion of the partially unfolded glove wrapper. Unfold the top and bottom flaps of the wrapper. Grasp the cuffed edges of the wrapper, touching only the 1 to 2 inch perimeter of the outer edges. Extend the wrapper edges to the side so that the wrapper lies flat. If the wrapper edges flop back onto the exposed gloves, the gloves are considered contaminated and must be replaced. Hyperextending the wrapper slightly may help to prevent the wrapper edges from flopping back onto the exposed gloves.
It is recommended that you don the glove on your dominant hand first. The individual demonstrating is left-handed and will don their left glove first.
The first glove is secured by pinching the center of the cuffed edge with the non-dominant hand, leaving a 1 to 2 inch distance from the point of contact to the sterile areas of the glove. Your bare hand is touching the inner surface of the glove that will be in contact with the skin of your wrist once the glove is donned. The glove is lifted up and away from the wrapper, allowing at least 12 inches of space in all directions. Keep the glove at least 12 inches away from yourself and other objects. It is helpful to keep the fingertips of the glove pointing downward to prevent them from flopping back and becoming contaminated. Orient the glove and apply it by inserting the fingers and thumb of the hand to be gloved and pulling the glove over your hand. You may touch anywhere on the folded edge of the glove, as long as the 1 to 2 inch distance from the sterile area is maintained. While donning the gloves, be sure that your hands remain above the lowest sterile level, which in this situation is the sterile glove wrapper that remains on the clean surface. The cuff of the glove may be unfolded by pinching and pulling the folded edge of the glove as long as the 1 to 2 inch distance from the sterile area is maintained. The second glove is secured by inserting the 4 fingertips of your already gloved and sterile hand under the cuffed edge of the glove. The thumb of your gloved hand may be tucked under the cuff of the glove, or it must be kept well out of the way to reduce the risk of contamination. Lift the glove up and away from the wrapper, ensuring that the thumb is not used to grasp the glove. Be sure to allow at least 12 inches of space in all directions. Orient the glove and apply it by inserting the fingers and thumbs of the hands to be gloved and pulling the glove over your hand and wrist. Be sure to stretch your arms away from your body to maintain at least 12 inches of space in all directions, reducing the risk of contamination of your sterile gloved hands. The gloved hands are considered sterile circumferentially to 2 inches from the exposed skin of the forearm. Typically, the sterile area is distal to the bend of the wrist. Make any minor adjustments to allow the glove to fit properly, remembering to touch only the sterile area of the glove. Leave the glove wrapper in its current location. It is recommended that the glove wrapper be discarded upon completion of the sterile task. You are now ready to proceed with the planned sterile procedure, such as prepping the patient's skin or inserting a Foley catheter.